Welcome back. It's time now for your question segment, and we're joined by Dr. Amit Bhushan Sharma, Unit Head and Associate Director, Cardiology, Paras Hospital. Thank you so much, Doctor, for taking time out. We have our first caller, Abhinav from Kota. Go ahead with your question, Abhinav.
Yeah, hi sir. Sir, I wanted to ask that my mother is having an allergy from bee stings, actually. So first time we went for the vaccination, doctor said that, okay, allergy, you have allergy, so you cannot get vaccinated. So I just wanted a confirmation if we can get her vaccinated or not.
Right, doctor?
If the allergy is mild and she does not have any symptoms of fever or shortness of breath and the saturation is well maintained, she can very well go ahead with the vaccination.
Right. Why is this that they're being refused? Because this is the second question we've had on the show in which someone asks about, an allergy. Another person had an egg allergy and they too have been refused at the center. So is it, are they just asking this blanket question, are you allergic, and then just refusing them?
No, what happens is because it being a virus mRNA vaccine, sometimes the chances of anaphylaxis or a severe reaction is there, in which the patient becomes severely short of breath and may require even immediate ventilation also. So that is the reason why if it's a mild allergy, we will avoid it. I would prefer that if it's a serious allergy or the saturation is down, then you might as well postpone the vaccination for some time. But if it's a mild allergy, you can go ahead.
All right, we have another caller, Nafisa from Madurai. Go ahead with your question.
Good afternoon, doctor. Is there a definite curative treatment protocol for COVID-19? Because what had been medical facts, like remdesivir, plasma therapy and hydroxychloroquine have been dropped now and they have become medical myths. And my second question is the dead body of the COVID-19 patient infectious? And why can't we hand over the dead body for a decent burial to the relatives after all the protective measures, doctor?
Right, Dr. Bhushan, I think a lot of people are, very confused with the medication that, first we're told go for remdesivir, then not. So she wants to know, do we have any definitive treatments?
So right now, ma'am, see, as it is, coronavirus, the studies are still evolving, and it's an ever evolving science, as we say. So the medical treatment is based upon some randomized trials whether it is beneficial or not beneficial. So some smaller studies had shown remdesivir efficacy before, but over a period of time, the longer trials have not shown. But I would still not totally take it off that it is not totally useful, because over a period of time it does decrease the virus load, though it has been taken off the guidelines in majority of the cases. But if the virus load is high, nothing is working.
Right. What we do know that works
is useful.
What we do know that works is steroids, but only at a particular time, and when the patient is feeling some sort of shortage of oxygen.
And if the virus load is high, it is shown to decrease the virus load also in majority of the cases.
And the second part of her question, which is very poignant, and I think a lot of families have faced this issue about, getting the body of their loved ones after the death, and, they don't get to really see it or have that sort of funeral that they would like to have.
Again, Steve, as I'll go back on this question. First is, Steve, the first 5 days or 7 days when we are using the mask, we are basically protecting the others, because that is a phase of virus replication when the patient is alive. After 7 days, am I audible?
Yes, go ahead. Yes, go ahead.
Yeah, so after 7 days, what happens is 7 days to 14 days, 15 days is the period where the maximum incidences of complications take place, and the patient is protecting himself against this. Now, so first 7 days, you're protecting others. Second 7 days, you're protecting yourself. As far as the dead bodies are concerned, what happens is, once you have a mass funeral or a mass burial, what happens is then it is again a source of contamination, because we do not know per se whether 14 days have elapsed or not, whether the virus shedding is still going on or not. So it is very difficult to streamline when was the peak phase reached. So hence the mass burial or mass funeral is not allowed right now. That is the reason why.
All right. Well, thank you so much, Dr. Bhushan, for joining us here on NDTV.
Okay.
Well, that's all the time we have on the show today. Thanks for watching. Goodbye.